What if something completely ordinary, like a routine checkup, ended up revealing something you'd never even thought about? That's exactly how it started. Just a normal Tuesday. He felt fine, maybe a little tired from work, but nothing out of the ordinary. Then his doctor mentioned 3 letters he'd barely heard before: PSA. He nodded like he understood, but inside, his mind started spinning. He was about to learn what this simple number meant, and why it's one of the most important, life-saving stats in men's health. What if a single number on a simple blood test could act like your body's personal early warning system? Imagine a tool that can help protect your future, but one that, if misunderstood, could also stir up unnecessary fear. That's the paradox of the PSA test. Today we're breaking it down. We're going to uncover what this number really represents, why it matters, and how understanding it can help you make informed decisions about your health. This isn't about alarm, it's about empowerment. So what exactly is PSA, and why should anyone care? PSA stands for prostate-specific antigen, a protein made by the prostate, a small, walnut-sized gland tucked right below your bladder. It's part of the male reproductive system and helps produce semen. A small amount of PSA naturally leaks into your bloodstream, and a PSA test simply measures how much is there. Think of it like the oil pressure light on your car dashboard. It doesn't tell you what's wrong, it just tells you it's time to look under the hood. PSA works the same way. It signals when your prostate might need a closer look. Why does this single number get so much attention? Because PSA is one of the earliest and most effective indicators of prostate health. It's best known for helping detect prostate cancer early, often long before symptoms appear, when treatment is most successful. But it's not just about cancer. Tracking your PSA over time reveals your own personal pattern. Everyone's number naturally creeps up with age, but a sudden leap, like more than 0.75 nanograms per milliliter in a year, can be a warning sign. Understanding your PSA isn't about bracing for bad news. It's about staying ahead of potential issues so you can keep living the life you love. But what if your PSA comes back high? Does that automatically mean cancer? Absolutely not. This is one of the biggest misunderstandings about PSA, and it causes more fear than it should. An elevated PSA does not mean you have cancer. In fact, most men with a high PSA do not have prostate cancer. There are plenty of common, harmless reasons your number might rise. An enlarged prostate, known as BPH, naturally boosts PSA as you age. Inflammation or infection, called prostatitis, can do it too. Even everyday things like sex, cycling, or a prostate exam done just before the blood draw can temporarily bump up your level. This is why one high number isn't a verdict, it's simply information. So what counts as a normal PSA level anyway? Here's the thing, there isn't a single universal, normal number. What's expected for one man might be unusual for another, and age plays a big role. Generally, under 2.5 nanograms per milliliter is typical for someone in their 40s, under 3.5 for men in their 50s, under 4.5 in their 60s, and under 6.5 in their 70s. But even more important than the number itself is how it changes over time. A PSA of 3.0 might be concerning at age 45, but perfectly normal at age 70. That's why getting a baseline, your personal starting point, is so valuable. Who should be thinking about getting a PSA test in the first place? Today, screening isn't a one-size-fits-all recommendation. It's a conversation. For most men, the discussion starts around age 50. But if you're at higher risk, if you're African American, or if your father or brother had prostate cancer before age 65, your doctor may suggest talking about screening at 45. And if you have multiple close relatives who were diagnosed young, that conversation might begin at 40. The important thing is not to just get the test blindly. Weigh the benefits and the possible downsides with your doctor so the decision fits you. What happens if your PSA test does come back high? What's the next step? First, don't panic. One elevated result is just a starting point. Your doctor will likely repeat the test in a few weeks to make sure it wasn't a temporary bump. They'll also check for things like BPH or infection. If the number stays high, the next step might be a physical exam or, increasingly, a multiparametric MRI, a highly detailed scan that can spot areas worth investigating. Only if something truly looks suspicious will your doctor suggest a biopsy, and today, biopsies are far more precise thanks to MRI guidance. The whole process is designed to avoid unnecessary procedures and only do what's absolutely needed. So what's the single most important thing you can do right now? Start a conversation. Talk to your healthcare provider. Ask about your personal risk. Discuss the pros and cons of screening. Your health is one of your greatest assets, and being proactive is the strongest move you can make. And if this information helped you, consider subscribing for more content that empowers you to take charge of your health.